I mentioned before we start, we have a guest joining us. He's going to join us via Skype. This is Dr. Robin Armstrong. I'll tell you very briefly. He does have a very prominent place in Texas. He's well known among Texas conservative Republicans. He has been the national committee man, or maybe even still is a national committee man, but he has been prominent in Republican politics, but he's also a medical doctor. And I saw actually, I'll just tell you, there were articles out there very unfriendly to him talking about his choice of prescribing hydroxychloroquine to patients in his practice in the Houston area who were suffering from COVID-19. And I want to get him on and just have him talk to us about why he prescribes it, what he's seeing, and what he thinks all about this whole controversy. So, Dr. Robin Armstrong, welcome.
Thank you very much for having me today. Thank you.
So glad you are here. Well, let's just jump right in. Let me start with, just tell us and our listeners, you're a doctor in Houston. How long have you practiced medicine?
I practiced medicine for almost 20 years. Ironically enough, my first day of practicing medicine was on September 11th, 2001. And so on 9/11 was my first day practicing. I completed my residency and started working in the hospital where I was born, which is where I work today.
Wow. Okay, that is kind of memorable as a date you'll never forget. Okay, so in Houston, you have a medical practice. You work at a hospital. You also, I understand, are the main doctor, in facilities that where people of more senior years are living, retirement facilities or care facilities. Can you describe all the different places where you are working in Houston?
Certainly. So I am the owner of Armstrong Medical Group, and we have about 11 practitioners, 5 doctors and 6 physician assistants and nurse practitioners. And we practice in hospitals predominantly. And so we have a hospital practice, and we also have a nursing home practice as well. We've got about 200 to 300 nursing home patients, and also practice in hospitals. And so we take care of ICU patients. We take care of patients just admitted for chest pain. And so we have a very wide ranging practice. We go to rehabs and other long-term acute care hospitals. And this is kind of was the backdrop of how we got started treating them with this medication, because we had a little experience in the hospital and we're seeing success there.
So one thing, as I mentioned a moment ago, there was a lot of coverage about whether you were, at least for some patients, prescribing hydroxychloroquine, and there's a mention of patients at a nursing home. And so I want to just ask you, so you're presented with patients who are tested, they're testing positive for the coronavirus, and they are nursing home patients. So assuming they're senior and maybe have some other health challenges.
Correct.
Okay, so what made you feel confident about prescribing hydroxychloroquine? What did you know about it before coronavirus came along?
So what happened was the nursing home, the medical director came into the nursing home, and there were 3 positive staff members. And so the medical director in Galveston County made the decision that he would test all of the residents and all of the staff. And so out of that testing, there were 56 positive residents and there were 31 positive staff members altogether. And so if you could think about that, that just devastated this nursing facility. And so what we've seen as examples is in Tennessee and in Washington State, where they had 22 residents who died, and in Tennessee, where they just unloaded all of those patients into the hospitals. And so they literally called EMS workers. And I remember seeing it on national news where you had all these EMS workers that were lined up, picking up these elderly patients and taking them to the hospital. Now, every physician knows that that's a disaster for these elderly patients. I mean, their morbidity and mortality goes through the roof if you're transporting them to the hospital. It goes through the roof when you're admitting them to the hospital and taking care of them in the hospital. And so that was just a disaster waiting to happen. You expose EMS workers to COVID-19, ER nurses, ER physicians, ER staff. You expose this whole group of people to this very contagious disease, number one. And in addition to that, you increase the morbidity and mortality for this elderly population. You do not want them going to the hospital. So our goal, when we saw all this, we made the decision that our goal, once we had all these positive patients, we made the decision that it's best for them and it's best epidemiologically to keep them in the nursing facility and try and treat them there with the only medication that we had available.
Okay, I do want to get to the Tennessee story, because before we came on air today, you were telling me that, and I had not heard that Tennessee story, but back to your facility. So you had 56 of the residents and 31 of the staff who tested positive for coronavirus. Right. Does that mean that you did all of them then, or did you prescribe to all of the 56 patients hydroxychloroquine?
No, absolutely not. What we did was we looked at the patients, the persons who were employees actually went home and were told to quarantine in place, and because they were mostly younger and healthier. And for the nursing home residents, we put them through a pretty strict criteria. We saw them, examined them, saw their clinical symptoms, assessed them. We measured their respiratory rates, measured their oxygen saturations. And what we found is that these folks, when they had stable oxygen saturations, when they started to drop a little, that gave us concern that they were going to crash. And so what we did was tried to catch them at the point right before they needed to go to the hospital, and then we'd start the medications there. So we started the meds on 39 out of the 56 patients, because those were the ones that were clinically appropriate to start it on. And then we just followed them very closely. We saw them every day, watched them, managed them, and so far we've had pretty good results. Now, our regimen was actually more than just the hydroxychloroquine. We used hydroxychloroquine, 400 milligrams twice a day on day 1, and then 200 milligrams day 2 through 5. And we used azithromycin, 500 milligrams on day 1 and 250 milligrams on days 2 through 5. And we used zinc, 220 milligrams daily for 5 days. So it was a 5-day regimen, very short. And what we've seen is we've had some success. This past Sunday, yesterday, Easter Sunday, was the last day that our last group that we started were on the medications. So as of now, we have no one on the medications. And this Thursday, it'll be day 14, which will be a really important day for us, because that'll be the day where we think they're kind of, over this. And so it'll be really exciting on day 14 this Thursday.
So among these patients, and again, I think I was writing down correctly, of the 56 residents who tested positively and 39, you began this regimen of hydroxychloroquine and everything else you just said. How are they doing on it? Have you had bad side effects from it?
We've had no side effects on it. The big concern that the doctors on television say is they're concerned about, they say cardiac arrest. And some of them were doing very well. And so some of them, if their oxygen saturation looked good, and clinically they were not having any symptoms, then we saw no reason to treat them. And then some of them, a few of them were on hospice, and so they were very ill patients already. And so a combination of what you just said, some of them were very ill, and we knew that their prognosis was very poor already. And then some of them were doing so well that they didn't need the treatment.
Okay, so this is just the most fascinating thing, because I don't recall in my life, I'm not a medical person, I don't have medical training, but I don't recall in my experience having physicians in this country being so subject to scrutiny by the media and by politicians about choosing a certain prescription course. So let me just start with, and I want to talk about what you think is motivating that, but do you have other instances in your medical practice where you made a decision based on your knowledge of medicine to prescribe something and received either political or public attention and criticism for it? Do you recall anything like this?
Absolutely not, and certainly not in medications that have been used for decades like these. This medicine is Plaquenil, or hydroxychloroquine is a very old medication. It's been around for a long time. Been used for lupus. I've used it in patients of mine, used in rheumatoid arthritis, used in malaria as well, though I've traveled to Africa a couple of times, and I can tell you it's not a very good anti-malarial prophylactic drug, but it's used anyway. And so it's I haven't seen it. I've not experienced anything like this before, certainly not in my own practice. And I've never really seen it in other practices either, unless you were getting bad results. And so it's ironic that it's getting so much media attention. I guess I can understand it if the results were negative, and if patients were having bad side effects and patients were dying on the medication. But in this case, we're seeing improvement. Patients are actually doing well, and so I don't understand all of the. I guess I do understand it. I think it's political, but I certainly don't understand why. Why there seems like everyone should be happy that folks are improving.
That was one of the points I was going to say. In what other possible context can we imagine so much shrill anger, denunciation, just kind of hysteria over the prescribing of something which, according not just to you, but to the study done by that French company, I don't have the name in front of me, but they had 79 of 80 of their senior patients recover from using hydroxychloroquine, recover from COVID-19. You have Los Angeles doctors and Florida doctors, and yet somehow everyone who publicly touts this is just subject to, it isn't just, it's a hinting at, in fact, I think one of the words was dangerous, applied to you, disconcerting. It was disconcerting that you would do this. I mean, what do you think is driving this hysteria about the prescribing of hydroxychloroquine?
I think what's driving it is that the president was touting it. The president mentioned it, and that he was touting it and saying that it was promising. Now, all he said as a non-medical person was that it's promising, and certainly he has experts around him. He has very good physicians around him, and so he said it was promising. And so what that did was actually helpful for us, because it did allow us to have more access to the medication. It increased the supply, and so but it allowed us to use it if we thought that our patients would benefit from it. And like I say, I still have the treatment regimen protocols left over because I haven't used them all, because not all the patients were appropriate to be treated with it. And so it's so important that we're allowed that access and we're given that free choice to be able to make that decision. And I think people are responding this way because they don't like this president. And I think that's unfortunate. Someone actually asked me, had I called the White House and talked to them about this? And I just thought that was such a silly question, because I've never called them about any of my other patients either.
Okay. Is there any, in the practice of medicine, there's a Texas State Medical Board, I'm not the name of it, but is there any system in place, or for example, the Texas Medical Board, is there any oversight to what prescription choices patients make? I mean, doctors make in their everyday treatment of patients? I mean, I'm getting it really, isn't it the norm? Wouldn't it be that most doctors can prescribe what they believe to be justified or needed? Sure. And there is not oversight pretty much over what they prescribe unless there's a problem. Is that right?
That is correct. That's correct. The Texas Medical Board oversees physicians here, but generally there's a lot of latitude in what we can prescribe, because it's based on the clinical scenario. This is certainly an off-label usage, but there's many off-label usages to medications. Yeah. Hydroxychloroquine and azithromycin are very, very commonly used medications. There are millions of Americans on them today and have been for some time, and I suspect they're not getting COVID-19. And so we are. So there's lots of evidence that it's helpful. And so the Texas Medical Board gives us a little bit of leeway in making those decisions, certainly in the setting of a pandemic where you really don't have time to have a large clinical trial, and where the lives of people are at stake today and tomorrow.
That's exactly one of the points I'm going to get to. It's the most amazing thing to watch. On the one hand, you see the extreme concern about America and people over the world that this coronavirus kind of seemed to leap forward all of a sudden, and we're in the middle of it all over the world dealing with a challenge. There's a drug that doctors all over the world are saying, wow, this is seeming to be helpful. And yet for some reason, in what seemed like the most kind of textbook example of where you should encourage people to be trying to find something that would prevent death, instead you find criticism for people prescribing what seems to be helping. I mean, I find that it's unprecedented, it seems to me.
It is unprecedented, and what it does is it certainly dries up the supply of the medication, because folks or physicians are so afraid to use it because they think they're going to have a lot of media scrutiny, and so that's unfortunate. So actually, what the media is doing is they're actually harming patients. They're harming folks who are elderly or in in these nursing home situations. And they're harming them because they're actually lessening the choices that they have because people are scared that they're going to get in trouble for prescribing them. And so that's unfortunate. I don't know that they're trying to do that. I just think they're just so Trump-centric. They think that their whole lives seem to be revolved around President Trump and trying to get rid of him and trying to hurt him and trying to harm him, that if they have someone who is a Republican and an activist and a Trump supporter, and that person is also a medical doctor prescribing a drug that Trump touts, then their brains automatically equate those two and say, well, maybe he's doing this for President Trump, and that couldn't be more. That's crazy.
Well,
and so I think that's so unfortunate that they think this way. So my whole life is not revolved around President Trump. I appreciate him as president. I think he's done a great job. I support him, but that has nothing to do with my medical practice, and it doesn't today, and it won't tomorrow.
It's crazy, but it's also very insulting to think a doctor of your stature and years of practice would engage in the prescription of anything you even questioned its efficacy or danger.
Right.
Just to humor. It's insulting to your medical for who you are as a doctor. Okay, this is a really narrow question, but it's been bugging me. So the people you talked about in this facility who were staffers who were younger and they tested positive coronavirus and they're sent home to quarantine. Those people who've come in contact with the virus but aren't manifesting symptoms, are they just sent home and quarantined and there's no medication? They just kind of work through it like you would a flu. Is that right?
Correct. That is correct. That's correct. And so most of them did well. Some of them actually did need to be hospitalized, a small percentage of them. But I believe everyone is, I think there's a couple in the hospital still. And so they were hospitalized for quite some time and they got pretty sick. And what we see with this, because in the hospital, I've taken care of some patients who are younger as well. And what we found is there's a profound hypoxia. These guys it's hard to oxygenate themselves. And so they have a really high oxygen requirement. And I'm certain that they were started on hydroxychloroquine and azithromycin in the hospital and probably would help them get better. That's where I was exposed to it in the hospital initially, taking care of younger patients. Then we were confronted with this situation in the nursing home. And we thought, for young people, they have a little more reserve, so they're healthier. They don't have all these chronic medical problems. And so we can wait a little while longer in treating younger people. We can wait until they get a little bit sicker because they're going to be able to pull through with the chronic low oxygen level or an oxygen level that's low for a few days. Older people can't withstand that. They're with the low oxygen level for a few days. They're going to have heart attacks. They're going to have strokes. And so they're not going to be able to withstand it because they have less reserve, more comorbidities. And so those folks are at extreme risk of dying. And so that's the rationale for starting them a little bit earlier than you would start a young person.
Okay, and back to the young people who didn't become extremely ill. Is it accurate? Because I've been reading these things I didn't mention ahead of time that I want to ask you about this, but I've been reading to finish on the young people. So they head home and they've had a positive test coronavirus, and they're not feeling great, but they're not terrible, and they may have either asymptomatic or mildly symptomatic. They wait out the 2 weeks and they're all better.
Right.
So for them, there has been no medical intervention. They're back on track, and they can go back to work, and they are then considered a danger to be around. I don't understand how you decide they're okay just because they stayed home for 2 weeks.
Well, so that is a question that is left. We're not completely sure about yet. Now we know that once you have it, those folks, they build up antibodies to it. And so they are probably immune from a COVID infection now. And so we're not sure how long it will be before they're not shedding the virus. And so we think that if you can do an antibody test for them, then that will show that they have immunity. So we'll assume at that point they're not shedding the virus. And so everyone's working on these antibody tests now. That's going to give us the definitive answer. What we're doing right now is some of those workers actually were invited to come back to work and they're working with our COVID-19 patients. And so some of the people that were infected, and so that's, one thing that we are using them at. They're ready to come back to work. They've been on 14 days of quarantine. They may still be shedding the virus, but they're working with patients that are already positive for COVID-19. And so it's okay. It's safe for them to do that. And so those folks are even coming back to work, even though we know they were positive.
Okay. One last thing. This is so interesting. I'm really learning a lot, and I'm trying to take notes while you're talking too, but I've been reading more about people who have gone in just to have the coronavirus test to see if they have been exposed or not, and getting the answer that they actually already have antibodies, meaning they previously had it and didn't even know it, kind of got through it with either asymptomatic or mild symptoms, and they're fine. So I'm sure you've been reading about this, but is it possible that this virus has been here much longer than we realized in America?
I doubt it, because it looks like it's we're not sure where it's from. It's from Wuhan, China. We know that, but it looks more like an animal virus. It is a coronavirus, and so there's a family of viruses called coronaviruses. I was a microbiology major at Texas A&M, and so I studied about coronaviruses, and the family that we normally study, they just cause a common cold. And so, but this is a different one. This is a different type of coronavirus. It has a little more of a different function. So this is a strange one. It's not behaving like a typical common cold, in a sense that it's more easily transmitted. And so it looks like for every one person that's infected, that they'll probably infect either 2 to 3 people. And it's also a little more virulent strain than a normal common cold as well. So it's under the coronavirus family, but it's a lot different. And so I don't believe that it's been here for a long period of time. I believe that this virus it's novel, came from China, probably then went to Europe, and then from Europe came over to our East Coast. And certainly the Chinese cases are more on our West Coast now. But I think this is something that's new and different. And so it's something that's taken a little while to study, because it's just the way it behaves is just a lot different.
Okay, so Robin Armstrong, I'm going to tell you, first of all, I read one article that had been written about not just you, but about doctors in general who were prescribing hydroxychloroquine. And one reason I wanted having the show is just to say, I think it is just so astonishing how a earnest, hardworking, caring physician could be. It's one thing to, question medications that maybe are slightly unknown, but it's just kind of it is an avalanche of criticism. And I really I'm so glad you came on and could explain, why you chose to prescribe it, what your observations have been about the patients who've been working through it, which seems to be the basic answer. It seems to be doing its job, that the symptom, the patients, I'm assuming, in your facility who've been taken, they seem to be improving. Is that right?
Absolutely. And what's really disappointing, Debbie, is that there is a risk for us as well. And I've got pictures of me in a shield and a mask and a hard hat and a gown and shoe covers and all that. And so there is a risk to myself, and there is a risk to my family as well, spreading this virus. So not only are they criticizing someone who is earnestly trying to help their patients, I've actually gone in and seen them every single day for the last week. And so while they've been on this protocol, and so it's really unfortunate to get criticism from someone who is not risking their lives, not risking the health of their families, and getting this criticism. It's unfortunate, and I think it's rather selfish and short-sighted, and so that's disappointing as well, because I've been working 15, 16-hour days and in that facility, seeing a whole lot more people than I normally see, and in addition to that, seeing folks who are infected with a virus that has taken the lives of many medical professionals, many nurses, and many physicians around the world. And so it's just it's disappointing to see what the media has done with this story. And I think I would love to invite them to come and dress in the gear that we have to dress in and go in and see our patients with us. I suspect that they would not be willing to do that.
And on that note, that was a great closing point to make. Dr. Robin Armstrong, thank you for all you're doing, helping coronavirus patients, COVID-19 patients, and really speaking out against this media tyranny, criticizing doctors around the country who are using something which appears to be helping these patients who, especially in the vulnerable population that you're describing in the nursing facility, these are patients who have a lot of other choices and may have been very vulnerable to being to lethality from this virus. So thank you for all you're doing, and thank you for explaining so much. I feel like I kind of went to I don't know what, like coronavirus 101 seminar. But thank you so much.
Very much.
Yeah,
thank you very much, Debbie. Appreciate it.
Great to see you. Thanks for joining us, Mayor. Can we talk? Thank you, sir. Hang in there.
All right, we'll do.
Okay, that, my friends, is Dr. Robin Armstrong, and you can read on our website, AmericanCanWeTalk.org, on the homepage under shows, drop down list of links. You can read a little more about him, and you can read about what some of the critics were saying. Honest to goodness, that he's so polite and classy, but I don't feel that polite about the people in the media who are engaging in these attacks. I think they really are hurting. They're alarming doctors around the country. They're hurting patients around the country who are fearful there's nothing that can be done. All sorts of bad things are flowing from the media's conduct, and needs to be called out. And the worst part of it is, in the case of many people in the media, the simple fact is they're driven by utter hatred of Donald Trump, and anything they can do to bring him down sounds good to them. Okay, so thanks, Dr. Armstrong.